We are going to discuss this 30-year gentleman's case today. It's a very interesting case. He did one of his hair transplant surgery, I think 5 to 7 years back. He almost got no result. He was having unwanted sparse hair at the hairline. So he started wearing the patch. He wore the patch for around 4 5 years. Then he decided to do the hair transplant with us, which is a second hair transplant by us. When we understand that patients are looking for a second hair transplant, the donor area is depleted. कुछ ना कुछ उनका donor area कम हो चुका होता है 30 या 50%. And for the second surgeon, it is very difficult to obtain or harvest as many grafts. So we did his surgery with 5,000 grafts from the back of the head area and from the beard. He implanted and a decent amount of the coverage is come compared to his baseline pictures. He was very happy around 8 months, 10 months. But he told me, doctor, my profile is such, I need to be presentable in front of people and also in front of the camera. So can we fix this thing? So the third attempt that we did, it was with a synthetic hair. So if you see the final outcome, nice natural looking hairline, proper volume even from the top area, and overall very sleek appearance of the face. And hopefully this before and after journey is useful to you. So certain cases that we select for a synthetic hair transplant is very critical. Someone who wants a proper looking volume without wasting or without touching the donor area. That's one candidate. Secondly, is someone who wants very quick outcome, because in natural hair transplant progression, it takes around 6 months or 8 months to get a decent outcome and 1 year for the full outcome. Someone who wants a very quick improvement of for the synthetic hair implant. However, this journey is always not the same. Sometimes patients are looking for a high density look with a synthetic hair implant. So there are certain drawbacks, there are certain hurdles or hiccups around it. So we need to also understand the side effect part of it. So what are the possible things we can consider? One is the too much of the density when it is given with a synthetic hair implant. It can lead to infection. Sometimes it is not being cleaned properly. It also can lead to granuloma. However, we do the trial of 100 stents before the synthetic hair implant, but the long-term rejection is also one of the most important things. As far as the maintenance of the synthetic hair is concerned, every year there is a fallout rate of 10 to 15%. So patient want to repeat this procedure at 4 years or 6 years, depending upon the look they want to achieve. Hopefully, this journey is useful to the patients who are looking for a hair loss related treatment, because we tend to offer a lot of options as far as the hair loss treatment is concerned, as far as baldness is concerned. When patients do come to us at an early stage, we try to evaluate what is causing the hair fall, whether it is a nutritional deficiency, whether it is systemic disease, or there is some local infection of the scalp, or it is a simple genetic hair loss in the men or women. In certain cases, at early stage, the conditions can easily be managed with medicine. In advanced stage, the dermatology, minoxidil, predensal, procapil, finasteride, dutasteride options are used. And in advanced case, we do the normal hair transplant or a synthetic hair transplant. Hope this video is informative to you. You can share this with your friends and relatives, someone who needs this information. Thanks a lot. Malay Mehta from Mumbai.